Okay, so what I want to do now is to introduce to you the overall conclusions and recommendations we retrieved on the use of evidence synthesis for the impact assessment of GMOs and related to the impact research. So this talk will be subdivided into two major parts. So the first part will deal with the use of systematic review and evidence maps for the assessment and communication of GMO impacts. And then the second part is more focused and asks the question if systematic reviews and evidence maps are appropriate tools to inform GMO risk assessment and management. So now related to the first part on the use of these evidence synthesis approaches for the assessment and communication of GMO impacts. So I think it became pretty clear now from this session that especially when you think about the review protocol, now in the case of evidence maps, that it has the capacity to facilitate the communication and discussion of assessment criteria. So especially for evidence maps, it would be the selection criteria. So in order to clarify which potential hazards are regarded as relevant in the scientific society, which exposure routes are regarded as relevant. And like this, evidence maps have the potential to harmonize future test designs. If you think about the overall report of a map, you could think about that it's a powerful tool to identify knowledge gaps and like this target future research activities. Furthermore, an evidence map can lead to the identification of specific sections where it would be worthwhile to perform a systematic review on. Now coming to systematic reviews, so firstly related to the review protocol, as in the case for an evidence map, it is or would facilitate the communication and discussion of assessment criteria. So in addition to the selection criteria, we now have the critical appraisal criteria, which would help to determine what is regarded as a robust test design to answer a specific question. And this then again would facilitate the discussion and would then also have the potential to harmonize future test designs which address a specific question. And what has to be highlighted is that in the course of G-Twist, which will be introduced to you by Pablo tomorrow, there are critical appraisal criteria developed in order to assess the robustness of feeding trials with whole food feed. And these criteria will then be applied in a successive systematic review, as already mentioned by Gijs, on an outcome of GRACE, which again highlights the synergistic effects between these two EU-funded projects. When thinking about the review report, so in the case of a systematic review, the review report provides a robust answers to a specific question and also provides a defensible input to evidence-based discussion and debates. It furthermore has the potential to clarify existing uncertainties, and as such it is a powerful tool to facilitate the communication about potential impacts also to a broader audience. But when saying this, you also have to consider some critical issues when thinking about the use of these evidence synthesis approaches in the impact assessment or communication. So first of all, I think you have seen that systematic reviews are a quite not so easygoing procedure. So what is really crucial is that review teams are trained in these evidence synthesis techniques. Secondly, they are resource intensive. And also, if you think about using them as a communication tool, you would easy to read text should have to be provided to journalists and also to the public in order to make them understand what is the clue about them and what are the major conclusions or take-home messages. Then, especially in the case of systematic reviews, sufficient and robust primary data have to be available. And what was also faced within GRACE is how to deal with unpublished research, for example, data which are included in application, which are per se not confidential, but you are allowed to read them, but you're not allowed to use them. So you're not allowed to publish them. Then also, when you think about the vast amount of literature, which is, for example, published in Chinese or other languages, so there's also always the question about possible language limitations. If you do not have anybody in your review team which knows this language and can then assess these publications. Then what we also experience in GRACE is that because these evidence synthesis tools are now newly introduced into the area of GMO impact assessment, that we were faced with a lacking infrastructure. Especially in the case of socioeconomic reviews, we didn't find a journal which was able to peer review the protocol. So this has to be considered actually when thinking about all this, and also to think about possibility how to improve that. So now, very brief summary. I think that these two tools can provide an added value in summarizing and communicating impact research. They can guide future research activities, as in the case for evidence maps, but you always have to consider the limitations or critical issues that are associated with these tools. So now coming to the second part, and this deals with the question if these tools or systematic reviews or evidence maps have the capacity to inform GMO risk assessment and management. So in order to answer this question, two major issues have to be addressed. So the first question that would need to be answered is, do they provide data compatible with risk assessment and risk management demands? And I think this can be clearly answered with a yes, as we have this PICO structure which nicely is in line with the comparative approach which is followed by each risk assessment and management. The second question would then be, do they potentially provide an added value? And if so, are they feasible? And this last question will then be the focus of the next couple of slides. So first, a possible added value of systematic reviews during GMO risk assessment. And I think the basis of every risk assessment is the elaboration of a conceptual model within the problem formulation. And in this case, systematic reviews could provide a more rigorous evaluation of relevant parameters or variables considered in this conceptual model, and like this could provide defensible and, if feasible, quantitative answers to support decisions when framing the scope of subsequent risk assessment steps. During hazard exposure characterization, they have the potential to provide valid quantitative estimates regarding the intensity or likelihood of a hazard, as it was shown in the case of the non-target review. Then during the development of risk management strategies, they could provide robust statements about factors which can influence the efficiency of management strategy, as done by a protocol by Kai and Achim about baseline susceptibility of target pests, for example. And I think, very generally speaking, systematic reviews can support a targeted communication between risk assessors in general. But what you have to consider are the limitations which might be associated with these tools. So first of all, with systematic review, sufficient primary data have to be available. And this is, in the frame of the risk assessment, is highly unlikely for novel or rarely studied traits or events. So you also have to think about a question prioritization which might be needed, and you would have to develop tangible criteria to decide which question is now worthwhile to be tackled and the other one not. And when considering all of this, a recommendation or conclusions from GRACE results would be that systematic reviews might be considered case by case only. And this is in strong contrast to the new implementing regulation, which requests the mandatory conduct of a systematic review on potential effects on human and animal health of the genetically modified food and feed covered by the application. And here we have two problems. So the first is the availability of data, and the second would be the scope of such a review. So it would be much too broad, and the question would have to be broken down into several questions that can be assessed by a systematic review. And so I think in the future, I think clarification would be needed. What is meant by the systematic review as promoted by this implementing regulation? So already Jochen raised this issue. So is it more meant a systematic overview or a systematic literature search or something like this? So I think clarification would be needed also by the Commission on this respect. Now when thinking about the use of systematic reviews and evidence maps during the risk management, so we have, during the post-market environmental monitoring, we have two scenarios. So the first is the case-specific monitoring, and the second, the general surveillance. And what you could think about during the case-specific monitoring is that systematic reviews could facilitate the integration and weighing of new studies by providing a consistent, transparent, and robust evaluation scheme that is readily updatable in form of a review protocol. Then during general surveillance, which has a much broader focus, as it's looking for effects that were not anticipated during the risk assessment. You could think about an evidence map that could provide an overview about ongoing research activities, being based on a bit broader question. But as already said in the introduction, also the broadness of a question to be asked by evidence map is limited. So if you think about the general surveillance, you would have to prioritize them as well. And if you think the scope, so looking for unintended, unanticipated effects, it's pretty hard for my imagination to come to reasonable questions in this area. Updating in general might also be resource intensive depending on the amount of primary data which has to be included, and especially for a systematic review, robust primary research data have to be available and accessible. Now coming to the second part of the risk management, which more relates to the evocation of safeguard clauses and emergency measures. And there what you could think is that a systematic review could facilitate the weighing of new information and assessment of its impact on previous risk or safety conclusions, for example, by the performance of a sensitivity analysis, if the new evidence falls within the scope of an existing systematic review. So in the case of safeguard clauses, what is needed is an immediate action. And so if you do not have a systematic review already tackling the problem under debate, it would not make sense to perform this, and it may take years. And this would be outside the scope of such a timely need to run into action. Furthermore, a systematic review would lead to a targeted communication about possible shortcomings affecting the reliability of the new information. But again, so depending on the amount of evidence, no timely answer might be given, and also robust primary research data have to be available and also accessible. And now to sum this all up, so we think that systematic reviews and evidence maps could provide an added value in informing different risk assessment or management steps about GMO impacts. But you always have to consider that sufficient trait or event-specific data have to be available, especially in the case of a systematic review. They have strong demands on resources, and a mandatory request, as done by the new implementing regulation, is just not feasible. And with this, I want to thank you very much for your attention.